Hi, welcome to Cloud of Witnesses. My name is Jeremy Jeremiah. Really exciting episode today. We're looking forward to this conversation. We're discussing addiction.
Happy to be back. My background is in addiction medicine, and I see patients also in psychiatry, but I'm an Orthodox Christian as well.
So my name is Father Timothy Curren. I'm a priest of the Greek Orthodox Archdiocese serving in the metropolis of Boston. I'm a convert to the Orthodox faith.
Father, tell us, why is this a subject of interest to you?
Certainly. Well, I like to begin by saying that I am in no way a professional in this field. I have worked in sub-professionally in the field of mental health, including addiction recovery. Recovery has been something that's been part of my life since I was young. People in my extended family have struggled with addiction, both in recovery and not in recovery. Jeremy, you and I had discussed previously that I kind of came up in the local hardcore metal scene, and so I knew a lot of people who were straight edge, and a lot of people that come to that lifestyle are coming out of a background of addiction.
You know, Father, you mentioned the straight edge scene. Dr. Daniel, are you aware? Do you know what the straight edge scene was?
No.
I actually think it would be an interesting topic quickly as to segue into this. Father, would you mind enlightening Dr. Daniel and our audience? Remind us of the straight edge scene. I remember it well, but I would love for you to talk to us about that a little bit, because I do think it does. It plays right into what we're talking about today.
Sure. Well, as far as my interaction with it goes, we were aware that it was something that got started in the late 70s, early 80s in the DC hardcore punk scene as a youth movement that sort of rejected the abuse of substances, hard drugs, drinking, and in some cases even casual sex. And so things that we would identify as Orthodox Christians as virtues. And it became associated with this music scene that was maybe to an outsider very aggressive and violent sounding, but was highlighting and upholding some important lifestyle choices that I think parallel very much to our Orthodox way of life. So just in a nutshell,
Father, I remember well. I was never part of the scene myself because I was raised in a evangelical, non-denominational home, and so I was kind of already straight edge for different reasons.
Right.
But I remember meeting friends, and they were into the same kind of music I was into, and we'd start talking, and the concept of drinking or going out to party or whatnot would come up, and they were saying, nope, I don't do that. And I would ask, because they weren't Christians. That was so fascinating. I would ask them why. They're like, oh, I'm straight edge. And meaning I abstain from those things. Dr. Daniel, I'd love to get your thoughts on that quickly. Just hearing that quick synopsis of the straight edge movement. Have you heard of, in your studies and in your practice, is there anything like that going on now? What does that say to you in terms of from your perspective?
Yeah, that's interesting. So, I'm from Ethiopia and grew up back then. So, 80s, I guess I was probably young too, but, not familiar with that. But the concept is, is a human thing, right? We always, we get into different things, and then we're like, okay, this is not working. It's leading to destruction. And then eventually we try to find a way to control ourselves. And stretch edge, it sounds like it's, something people are like, okay, I need to stop. And they create a label to help them come back to, God eventually, right? Even though, like you said, Jeremy, they were not Christian, but they're like, they knew in the truth that is destroying our life. So we see that all the time in an addiction, right? People initially slowly start to try to control themselves, right? And then without accepting help and the hidden slowly, right? And then when they see they can't, eventually they come. And then there has been a lot of movement, right? Say no to drugs, right? All different movements have come across. But the core treatment, right? There's the there's the medical and then there's spiritual. And so if those are not being addressed, these boundaries we try to create for ourselves don't hold a whole lot. And so but yeah, I definitely understand that concept, and it happens all the time, and people are like, okay, now I'm ready to accept your help by my, with all that you give me, instead of the parameter that I might create for myself.
Doctor, you raise a great point, and it's true. And I think what I heard you say there in part was that type of uh, movement, or this move to, hey, let's try to come up with something that's going to help us stay sober. It doesn't necessarily last. And Father, we know the straight edge movement did not last. It was seemed to be a little bit of a flash in the pan, unfortunately, even though some of the music still stands up pretty well. Father, can you talk to us? How do you recall, how did that scene kind of fade away? Do you remember the reasons why?
Um, I can only speak to my own experience, and I know a lot of people who managed to keep their edge, throughout high school, and it was very something I thought was very admirable. Um,
Mm-hmm.
but then would find themselves in a college context where the pressure is just by orders of magnitude much higher,
Uh,
and people would break their edge within the first year of going to college. I mean, I do remember people who just kind of calmly kind of set it aside and say, well, like I can engage in sort of more mature, social drinking or whatever.
yeah.
But I knew several people who it just kind of crashed and burned when it came to the maintaining those principles, um, purely for from the perspective of the subculture.
Yes. Same. A number of the people I knew that were involved in it, who even for a good couple of years, they were just staunchly straight edge. It was literally their identity. I hate to say it, years later, just kind of almost just went in the opposite direction, and went into, pretty blatant, abuse and whatnot. Doctor, can you talk to us about the underpinnings, or maybe the lack of underpinnings in a movement like that, which to your training would indicate to you, yeah, it's almost no surprise. The word fad almost comes to mind, or trend. Why does something like that not last versus, thanks be to God, the Orthodox Church, has now persisted for 2,000 years?
Yeah, absolutely. And I mean, so you see, even back in the days, right, when you're reading or the big book, right, when people start to read that, they see how even the movement came about, right? Like even medicine could not really solve it, right? The doctors would say, I've met your type so many times, right, to the patients, and they'll say, I just don't have a solution for you. You're going to end up dead, in a sense, right? In the big book, when you read that, you see how, eventually the individuals that created the 12 step and the recovery community, they had those spiritual awakening and encounter with God that eventually, right, helped them stay together. And to this day, right, long-term recovery happens when you're in those communities, and when you actually have a clear idea of who your higher power is, and and you live out your life in that sense, right? Medicine and all those things at the beginning may help you, but they will not last. And so with these movements, it's also they're focusing on themselves, and their own self reliance is what's happening. And as
Mm.
humans, in our culture, especially in America, we're so individualistic. It's you if you do X, Y, and Z, you will get to the top. But where's that top take you, right? And so, versus our faith comes from the East, right? It's a community. The Trinity is also the community, right? All those things are so central that it's not just me and what I can do, my willpower, all those things. So they help you to some length, right? But I always tell my patients, you have to see who your opponent is, right? If you
Mm.
take it lightly, what you're gonna attack with is gonna be very light. You're gonna lose, right? If it's only you, if you, it's like going to war. If you're going to war, you can't just be by yourself. You need all the tools and all, and back in the day they even prayed, I mean, right, even the nun godly dynasties, right, they prayed to whoever they thought was higher power, right? So that is key component to but it's a human effort, right? We're when we're in despair, and we talked about it a little bit, there are people who can drink sometimes, like, and that speaks of what addiction also is, right? As a disease, right? And in medicine, we talk about that, and it's a snapshot of what humanity is and what sin is and how our humanity gets corrupted, right? And so we can delve into that too. What is addiction medicine? Oh, all those things. But there are people who, 10%, 20%, right? They just can't, right? It's not and it does not discriminate. I've had patients where they're like, "Oh, I'm not the typical." I'm like, "No, everyone in every profession well, you have that, and so this is not people who have low willpower, or they're just bad people. It's not that, and so yeah, not to digress, but that's, I would say that.
No, doctor, I hear you loud and clear. It reminds me of as well, another reason why we're talking today is that, addiction, I think, is easy for some people, for the typical layman, to look at themselves and say, I didn't wake up in a gutter today. I'm not an addict. We're talking about other people. We're not talking about
Right.
me today. We're talking about the other people,
Yeah.
the people you see in the videos, that they have problems with, needle use and, these serious things. But then I heard a statistic just last night, and I have no idea how credible this is. It was on a video, and it was, someone said that 90% of males admit to using pornography, and over 60% of females admit to using pornography.
Oh yeah.
And I think that's just as much of an addiction as
Oh
anything
yeah.
else. And I want to, Father, hear from you in terms of, based on everything Doctor was just saying there, what are you seeing, in a sense, kind of on the daily? How has addiction and these issues, how does it rear its head in local parishes and in people's lives, trying to find Christ, find God in their lives?
Hmm. Yeah, I mean, I think that those statistics track with what my experience has been as a pastor, as a spiritual father. Certainly, pornography is big issue. Something that is so much more readily available in the modern era than going and scoring drugs I so that's something I deal with consistently in my work with my parishioners, my spiritual children. Another thing I'm seeing is, I know we've touched on the harder drugs always get highlighted, and for good reason. But I'm seeing
Mhm.
a lot of people who are of this wave that are coming into the faith, really struggling to not to succumb to marijuana use,
Mhm.
and that's something that we and Dr. Ageze can probably speak to this. I for since I was a teenager, the messaging surrounding marijuana use was, you know, um, really normalizing it, making it seem harmless. And okay, so maybe it's true, and Dr. Gizi can speak to this too. Maybe it's true
Hmm.
that it's not physically addictive in the same way that the harder drugs are. It certainly is psychologically addictive, and that's probably something that we should speak a little bit about at some point as well.
Please do, doctor.
Yeah, absolutely. Yeah. So there, each substance, right? The way it is, you get dependent on it. You have withdrawals with marijuana as well, and it can, it's actually a very unique substance, right? Like the other harder drugs, they have specific patterns of how they make you feel.
Mhm.
Depend, but their pattern is very straightforward versus marijuana, depending on the dosage, depending on the type, all these things that it can do to you. Initially it may help you, and then it will literally flip over, right? People use it for anxiety, and then they have worse anxiety.
Mhm.
They use it
Mhm.
for nausea, and then they're vomiting constantly, right? So there's so many, and then there's risk for psychosis too, where people actually have schizophrenia, right? With that too, and a lot of young, that get exposed. Marijuana is, even though people don't like to say gateway drug, it's most of the first common substance that people try because of
Wow.
what you just mentioned. It's so normalized. It's like, oh, it's okay, right? It's not. So even though, so there needs to be more study, and like, and especially for the amount people use it, right?
Mhm.
There are certain fields that has been approved for cancer, for appetite, but those are really, really micro doses, right? In a specific setting, and a molecule that is like manufactured versus what you're getting out there today. The concentration is is not like it was before, right?
Mhm.
And so definitely, it should not be normalized. And uh, everything that's legal does not mean it's safe, right? Alcohol, tobacco, marijuana, all of them do so much harm, right? People from opiates die, like, say, 90,000, 100,000 per year, but tobacco kills 500,000 people every year. But it's actually slowly does it, right? And so people think, oh, it's okay, right? But it's so harmful, and we see that all the time too. And
Doctor, I
yeah,
want to jump in here. This, because I
yeah,
think it's a very important point, and I'm really glad that you brought this up. You just now mentioned the concentration. I want you to really emphasize this point, because I hear it still to this day. People who are defending marijuana use, and they basically say it's a plant. It's a plant, and what God's created, we can use, right? It's like, what's the big deal? Please, please, please talk
yeah,
to us about, why is marijuana in 2026
yeah,
different
right.
than, yes, please.
Yeah. So I will say, before I say that, natural plants does not mean safe, right? I sometimes say to people, how about a snake venom? It's natural too, right? It
Who
will
created
kill
that?
you, right?
Yeah, yeah.
And so
Said the
natural
nightshade.
does not mean safe, right? And all the drugs, all the different things we get is from nature. Even if we synthetically make them, some of them, right? It's still from nature. So this is, it's actually a misconception, right, in a sense, right? But with marijuana, you know, these days, back in the day, the highest concentration you get is 30%, or even less. Nowadays, you can get 90%, 95 wax, all kinds of things, right?
Wow.
Those are really serious. And then when you add synthetic, right? When one time a synthetic had done many harmful things to people as well, but even the flower, all those things are super high concentrated. And I always tell patients, don't be the guinea pig, right?
Mhm.
This 95%, you're the first person experiencing it. You're just going to be showing up with psychosis, your brain. And the I get sad when I see parents bring their children, right? And all of a sudden they can't think, they can't process, they're literally dependent
Mhm.
now on the parents. And the parents like, what do I do with this child?
Father, what is the church's approach? How do you counsel someone who is genuinely interested in orthodoxy, wants to live the faith, and yet maybe they just might be of the mindset that, hey, this is, marijuana is just part of my life. I have a beer with dinner, and I smoke a bong before I go to bed.
Same thing, right? That's the equivalence in their minds. Yeah, no, I think it's good to, if we're going to talk about the church's approach to this, what I keep coming back to is, and I'm not going to, I may be misattributing this, but I seem to remember in when I attempted to read the Triads the first time by Saint Gregory Palamas, um, I believe it was in there that I read Saint Gregory as saying like that nothing that's created is good or evil, but it is it's use, it's in its use or its misuse, or our relationship to it is another way of saying those things. So that speaks to like, yeah, somebody could have a beer with dinner, or someone could, I'm pointing to my PS5 over here, somebody could casually engage in using video games, or maybe they can dispassionately scroll on Instagram for an hour and then put it down. But the potential is always there, and I think the reason behind that is because when we develop an addiction to something, and I'm just shooting from the hip, Dr. Ageze, I'm happy to be corrected by
Mhm.
you. It's often because there's something that we don't want to feel or think about or look at within ourselves,
Mm.
and so we kind of anesthetize ourselves or distract ourselves with substances, with behaviors, with whatever it is. And I think that the Orthodox Church calls us to engage with reality as it is, because the grounding of that reality is Christ, who is the way, the truth, and the life. And to deeper engage with the world without mediating it with some kind of compulsion is to engage with Christ more deeply. And the church, glory to God, has a very kind of clearly defined. We could call it a treatment system. We could call it a roadmap in the spiritual life and the spiritual methods of the saints of the church who have been pleasing to God in all ages. So I think that we've talked. There's a lot of talk, or there has been a lot of talk about the meaning crisis
Mm.
being what's driving a lot of people into the church. I think some people's solution to that meaning crisis is to just switch off and go back to sleep and smoke up or drink or shoot up or whatever, or turn on the device,
Right.
and not think about it because it's disturbing. And those are the situations where people pick up and start using. Um, and well, we can go into this further, but I think from the spiritual side, because there's the spiritual component, there's a physical component, the psychological component. That's what the church has to offer, and I think that's what a lot of people are seeking and are hungry for.
Doctor, please.
Yeah, yeah, absolutely. So definitely, like, so there's like you said, the spiritual, the physical, and the psychological, and then there's exposure type too, right? So we always say there's the fourth one, and over exposure you also get more and more, right? When you get exposed to the substance itself, where there's the chemical component where it rewires your brain as well. But what you said, Father, it's so much true, right? And when you also see it with psychiatry, right? A lot of times when you dig deep and ask, how did you start, why did you start, what are your triggers, what are the reasons why you still do it, you see a lot of, it could be pain, it could be things that they don't want to face, trauma history, mental health itself, all those things that make it easier for people to just grab onto things and just let me just escape, right? Let me not just be here. Let me make it easier on myself to sustain my life, right? But
Mm.
when I'm clear minded, I'm back to it, right? So it's like that cycle of like going back and forth again and again and again. But there's no solution if we're staying in that, right? Which is why the church tells us, right? That's why there's confession, right? There's where you're emptying yourself and coming face to face and giving all the burdens you have to Christ, right? Putting at the foot of Christ so that you can be healed. You can actually, and you're not by yourself, right? That's the main thing. A lot of people think they're by themselves. I can't deal with this. and I'm just gonna use a substance, self-medicate, right? And they're just continually doing that. And there's so many people who self-medicate in other ways too, right? Like it's not just substance, and their life is they're not meeting the goals that they want. They're not connected with God. So this, I always say, I got into addiction medicine because I was searching for God and I was lost myself, and it's through that I was that I because I was so focused on the body, right? I was focused on the body. The body is the one that's left. If disease, you will die. Let me just preserve it. Is again self sustenance, right? Versus you're like, okay, the body is we're only here for a short time. Actually, there's a spiritual realm. There's a spiritual body, not body, but we're not just matter, right? And so that is what eventually led me to be like, oh wow, I did not know this existed. This is the one of the few areas of medicine that actually recognizes the spiritual treatment that is
Hmm.
so necessary compared to you just throwing, giving medicine. Good luck, right? Uh, and so, yeah, it's very key that we realize what the treatment is. There, it's not, or we have to be connected back to our God.
Amen. I want to push on something you said, Doctor, and then Father, I've got a kind of an anecdotal question for you as well to follow up. Doctor, what is your response to someone who says, Doctor, you're talking about people who are trying to, in some way, hide from themselves or hide a part of themselves that they're afraid of, or, this self-medicating. Eh, you know, I just enjoy it. It makes me feel good, and it's
Right.
that simple. What would you say to someone like that?
So usually there is a component of that because anything you do not like, you will stay away from.
Hmm.
There is a grab to it that these substances are doing temporarily, right? They're helping you. So that's the hook, right? It's like the devil gives you something to chew on until, but there's nothing behind it, right? It's temporary. It's so there's a component of yes, I like it because it makes me feel X, Y, and Z this way, right? Because we have so many substances, and when I talk to patients, they all the time they tell me, "Oh, this is my drug. Oh, I tried this one, but I didn't like it, so I don't use it anymore." Oh, yeah, it makes sense, right? You didn't like it, so there's a component of liking it, but as people get in recovery, they also evaluate that concept and say, is this substance really my friend? Or is it just a fake at the beginning? It's giving me a little bit of something, right? But truly, it is not progressing my life. It's destroying my life. And so saying, and I've had people where they're like, I saw their true face, my friends, and so I left, right? It's the same way the substance is also there's that you haven't seen the true face of that substance
Yeah,
in a sense and
I
what it
see.
does to you. uh
Right.
and sometimes I don't want to say self-denial, and there are people, like we said, they can drink and just stop, right? There are people who can't, right? So you have to have self-knowledge too, and that's what the church helps us to know, right? Self-knowledge is key. uh but at the same time, exposure also can lead you there, right? So you can't say, "Oh, I don't have any genetic problem," blah blah blah. You could be
Mhm.
the first one to start it, and
Hmm.
that's what sin does, right? Sin is when you practice it, right? Eventually, it holds of you, then you become a slave to that, and then eventually changes who you are as a human, right? It's not sin is not just breaking rules, right? To your core, it changes who you are, and then that's sometimes we can't track, right? We in medicine is still lagging behind, but I think, and the church tells us too, that you inside get changed even to the level of DNA where eventually you can pass it down to your child, right? So it becomes a generational thing,
Wow.
right? And so
Yeah.
then, but science is trying to say, oh yeah, oh, we see it in genetics, but how did that come about? If we think about it, there's probably that component to it. And so
Yeah.
uh
That's powerful.
yeah, so I'll pause there though. Yeah.
Father, if you wanted to add your thoughts to that, but then I've got a question for you as well that I'd like to pose to you.
Well, I actually have a question in that
Yeah.
respect, related to what Dr. Ageze is saying. One thing I've noticed in sort of the popular culture is that, and then moving into the medical field, is utilizing hallucinogenics in actually helping people kick other drugs, and I couldn't help but be dubious about it. You mentioned situations like if somebody's recovering from cancer or glaucoma or whatever. Um, control the application of micro doses of certain, drugs that can be abused, can be helpful. Is that something that you're familiar with at all, and can you speak to its efficacy?
Yeah, so that's interesting because they're doing a lot of studies, right? Initially, they ketamine is one of the ones that they were studying to see if it would help. Even MDMA, which is ecstasy, right? So some of the studies have not come out because initially you had this movement, or even psilocybin, all these things, right? So they're
Thanks to Joe
trying
Rogan.
in a controlled, right? So
Yeah.
in a right, in a controlled environment, you try these substance hallucinogens, right? They're allowing you to pause and be able to experience your past life. For example, for people with severe trauma, right? To be able to walk through it in a way they can process it in a very controlled manner, right? They've done some of those studies. There's, the jury is still out in a sense, right? So there is, like you said earlier, not everything is bad, right? Everything that God created has its own goodness, value. It's how we use it and how we can. So for the right patient, for the right person, it
Hmm.
may
Hmm.
be component to it, and we have to be discerning, right? Not black
Hmm.
and white, kind of where we're saying all of it is bad or all of it is good. And that's why this is a multidisciplinary thing, right? You need
Right.
your doctor, you need your physical, everything has to be, your psychiatry is important. You can't ignore spiritual, right? It's not a
Hmm.
side thing where later, oh, after you recover, come back to it, maybe higher power, that's not the way it is too, right? So it's very key that and yeah, we're continuing to learn about that. And everyone is slightly different. So not everything is going to work the best for the person, right? And so, but there are some studies that they're still working on, but yeah, not conclusive in a sense.
Okay.
It's fascinating. Father, your
Yeah.
question was, ironically, is very in line, kind of where I was heading as well. I was thinking of hallucinogens, and can you respond to this question, which I think might be something you've been asked, or certainly I've heard people talk in these terms. And the question is someone who's come into Orthodoxy, or maybe has even been Orthodox for a while, and they're sincerely coming to you and say, Father, look, I know the church has certain views on substance use and all that, but to be honest with you, Father, my use of maybe of mushrooms or of other substances has actually helped me get closer to God. I actually feel more enlightened when I pray, if I've used a substance. Can you talk to that?
I don't. I can't say I've had the experience where somebody has said. I'm certainly aware that sometimes you do have people who their first inkling of the spiritual realm is through the use of usually hallucinogenics. Um, but I've never encountered somebody who's come to me and said, "Well, no, I kind of think this is good and it helps me in my prayer life." If they did, I'd have to say, um, "Okay, what's the problem with putting it down then and trying without?" You know, because I mean, to me, if somebody is um, what's underneath that question is a sort of a thin, a veiled um, resistance that is the beginning
Mm,
of a dependency. That's what I hear in that question. Um, so if it's so helpful to you, then what what put it down for a little while, try it without, see how that works. You know what I mean?
mm.
Because
Yeah, yeah.
because my suspicion is that's going to be harder than they anticipate.
Mm. Doctor, can you jump in on
Yeah,
that as well?
yeah, absolutely. I mean, so yeah, it's like who are you depending on in a sense, right? And
Mm,
and and we always talk about there's two sides, two brains. There's the addiction brain and then the brain that is trying to get you off of that in a sense, right? The addiction brain is trying to find all the ways and justification to still keep going and saying, oh, but it helps me find this. It helps me. Oh, I'm more closer to God this way. But are you truly, right? Sometimes it takes time to test that out, to be like off of it. And is that truly the case, or is this just what you think at the moment, right? And so it's key to be able to be like, okay, this is what you think, and just like I know Father as pastoral care, just the medicine also. There's that you're walking with them and saying, okay, how about you? Let's see, right? And so that I would say taking that approach because we always listen to ourselves, right? Compared to someone, I mean, for a priest, maybe they might hear you more, but or a doc, I guess. But we always try to be the people who come up to the solution. Go
yeah.
ahead, Father, if you want to
I,
add.
I do. I just want to add one more thing because what you said just made me think. Um, I, and Jerry, I grew up Roman Catholic. You grew up Protestant.
Mhm.
As opposed to people's experiences I know coming from Protestant backgrounds, I'm always very skeptical when somebody says, "Well, X makes me feel closer to God." I'm like, "What's your metric?" An important aspect of the spiritual life within the Orthodox Church is discerning spirits, right?
Mhm.
Discerning thoughts, or what are called in Greek logismi, right? Like, okay, you feel that brings you closer to God. How do you know? You know what I mean?
Mhm.
Is what you're experiencing lining up with the experience of the saints in the church? If not, I
Right.
think you have to be a little bit more cautious that
Yeah.
declaring that X is, and again, being close to God is not simply a matter of feeling or sentiment, as I know it's sometimes talked about in Protestant circles. I
Well,
think
that's yeah. Sorry, Father. Go ahead.
I was just saying that I think that's kind of it's a dangerous road to go down. I think
I
it's more safe to be skeptical of your experiences, and that's sort of what the experience of the church offers us. To proceed with caution, always, assuming that we're at the bottom rung, right? And that
Amen.
and not expecting that we're going to see visions of angels in our prayer life.
Amen. You remind me of so many things, and I realize why these conversations. I feel like we could go on here for 3 hours because one thing leads to another. But to that person who is saying, "Oh, I would use a substance to be closer to God," I when you look at the lives of the saints, you'd want to say, "Oh, so you're the first one, huh?" It's like, so you're that special person that that's going to pave the way. That is that, Father. I thank you for reminding us of how important humility is when we approach all these things.
No, I think that's important to touch on because I uh, it's a truth of our Orthodox anthropology. That a human being is not just a soul and it is not just a body. It is those two things together is what makes a human being. And I think that while there's a hierarchy there, clearly, in looking at the hymns and the spiritual texts of the church, even in the scriptures, um, it's not a one or the other sort of game, right? And certainly whatever happens to us spiritually is going to have physical consequences, and I think vice versa. Um, I'm a little concerned when I start hearing opinions going around um, that only want to focus on one or the other.
Mm.
Um, uh, I know it's in the climate that we're in now, and I understand why. And there's a whole other kettle of fish, about the medical field and pharma and things like that, and the suspicion we feel now towards these fields, legitimate or not. That's one thing. one of my personal spiritual heroes, Saint Sophrony here. He spoke uh, with some skepticism about the psychology of his era, of his time, but he didn't dismiss it outright. And I think there's a healthy suspicion in within our culture now of treating everything with a pill. You know, and there are treatment things that are branded as treatment programs that are purely uh, uh, using pharmaceuticals. Um,
Mhm.
my experience, those are usually pretty bogus. Again, I refer to Dr. Ageze. I also see the problem of saying, well, none of this psychological babble is valid at all. And it's of no use. All your problems are spiritual problems. I think that's also
Right.
a danger.
Right.
Because I think that again, those two, there's this profound understanding within the church of the human being psychosomatic, a soul and a body together, and you have to treat both those things, in my opinion. And again, I'll be curious to hear what Dr. Ageze has to say about that.
Amen.
Yeah, absolutely. So, I mean, medicine and science, science by itself is not the problem, right? It's who is using that knowledge, right? Are you only looking at matter, right? Or are you a practitioner or a person who sees the other realm as well, right? If And you'll see that, right? People who don't do that, they'll just kind of fix that. They just go in that route, and you'll and even back in the history, right? Medicine always tried to just stick to medicine, but the solution came from the 12 step recovery, where it had that spiritual element to it. And even now, there are certain science, fields, not fields, or practitioners or researchers that try to examine this recovery space, and they're like, oh, actually what helps is the community aspect of it, this part of it. They're trying to minimize and take out the spiritual element from it.
Mm,
And so there's man will always run away from God, but there's people who also recognize God and then see the full truth, right? So, and thank you, Father, for mentioning that, where whenever you err in one side, one-sided, just medicine or just spirituality, it's a very dangerous route, because I've seen people too where they're only spiritual, 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 and then they're having psychosis, all these things, and eventually they go to the doctors, and then they lose their faith, and they're no
Yeah.
longer Christians, right? Because we forgot the body part. It's almost like being Gnostic, right? It's like you're
Right.
just thinking about the spirit and only that. And when Christ became human, right? He incarnate. It's very key that we're looking at both and looking for providers, right, that have that mindset. And that's why we have I Am Recovery, right? In terms of like we're lining up, there's the medical component initially when you start detoxing, dependence, all that's important. But afterwards, you can't have any sustained recovery if you don't know God, if you don't know your higher power, if you're not living out. Because there are providers that just give you medicine, you see them once a month and they just throw that medicine at you. And then I see patients,
So,
many
so you're
afterwards, they're
trading
like,
one
oh,
dependency for another one.
yeah.
Yeah.
And the moment they don't have that medicine too, right?
Mhm.
They're done, right? And then they're relapsing, and they're like chasing it nonstop.
Mhm.
So it's really key that we're not splitting man into just one or the other, right?
Mhm.
amen.
And make
Amen.
yeah.
Gentlemen, I hope that this episode is helping to inform our audience and maybe give them some edifying wisdom related to this issue. To that point, can we talk about and Doctor, I'll start with you. What would you say are a few of the biggest misconceptions that we have as Christians when it comes to addiction?
Yeah, so sometimes we think it's just a behavioral problem, a moral issue, or just like, oh, and if we do that, we can. because people that are suffering an addiction, they can be stigmatized so much. I mean, it's hard to just even come out and ask for help. But if your environment is already seeing you in such a stigmatized way, you won't even open up, right? You're just gonna toughen it out, and just in it, whatever you hide, also, that's a place for the devil and everything else to continue, right? Versus whatever comes to light, right? So we have to allow compassion and love to our, those around us, to be able to come out and say, yeah, I do need help. I messed up. I did this. I stole from you because of my substance, whatever, right? There's a lot of harm that happens in this setting as well. But it's key that families understand that this is actually a real disease, right? And that needs both spiritual and physical help. And it has to be, like I earlier mentioned, it's a war, right? And we have to be able to help people in that sense. So not over spiritualizing things, right? Remembering that we are physical bodies as well, and there's a chemical component, all of those things, to be able to say, okay, just like we would treat diabetes, we should treat this too, right? And we have to be uh, allow people to come to truth, right?
I have to say, I really felt what Father Ageze was talking about there in terms of moralizing people who are suffering with addictions. I've seen on multiple occasions issues where um, even between a married couple, between spouses, one will come forward with an addiction they're struggling with, and the other spouse cannot go beyond the moral outrage of,
Mm.
or the hurt that's been caused by this addiction.
Wow.
And it's something that needs time, and it needs engagement, and it needs that co-suffering love that Christ showed us, to our whole humanity. We need to put that into practice when treating or dealing with people who are dealing with all sorts of addictions. I really liked Dr. Agese's analogy of treating diabetes, because it's like, okay, you could give somebody a treatment to help them manage their symptoms of diabetes, but if they've eaten themselves into a diabetic coma, it's if you don't treat the reason why they were using food that way,
Mm-hmm.
it's just going to
Mm-hmm.
continue to be an issue. I think
Yes.
that's a great illustration of this being a holistic human approach that the church emphasizes. Um, I'm not sure if that answered your question, Jeremy. I'm sorry.
No, no, it absolutely does. And I myself also really appreciated that analogy of treating diabetes. And what I would want to highlight from that is, you know, look, we're all humans. We're all fallen short of the glory of God. We all struggle. And I know, because I've seen it, in my life and in parishes I've been involved in, it is so easy to look at the other,
Mhm.
right? There's the us them mentality is so strong, at least I know in my life and what I've seen. And that idea that if there was someone who came to us and they were a diabetic and they were having their diabetes treated, we of course would not look at them with any moral judgment. We would welcome them into our group and our home and with love. And yet, as you both have pointed out so well, if that person is struggling with a methamphetamine addiction, uh, I don't know. I
Yeah.
don't know if I'm inviting. That is now. I know, of course, that there are things we can discuss. Depending on, there are dangers involved and associated with certain behavior and addictions that sometimes carry over. But in terms of how ought I to approach them and see them and treat them with love and understanding, and Father, as we talked about earlier, humility,
Mhm.
I'm no better off than any of these people.
Right.
And I think remembering these realities is, I think, important as well. And Father, maybe you can speak on that further, and then we can get some thoughts from Dr. Daniel.
It's that bumper sticker you see everywhere there, but for the grace of God, right?
Amen.
That's what we need to recognize, is that and that's what in my limited clinical experience, came to the conclusion of, when I was bringing the kids from the unit I was working on at McLean over to the AA meeting every Saturday, is that I'm getting so much out of this. Do I have a problem with drinking? No, right now I don't. But I've got my stuff that I am dealing with, and I can be just as enslaved to certain ways of thinking, certain behaviors, as someone can be to drugs and alcohol. So it really needs that recognition, that humility, of our own fallenness, our own human weakness, and our need for Christ to heal that which is lacking in us. To Because this is going to be all, and the thing that the orthodoxy, I think, kind of, it can be challenging, it can be exhausting. There's such a thing as orthodox burnout, but it's also a incredible hopeful message that this is the process that's going to last your whole life. Expect warfare to the end. I think it was Abba Piman from the Desert Fathers, to the last moment. Um,
Mm.
and that can seem daunting, but the church offers it as a reminder, a hopeful reminder, that we are not alone in this fight. That
Yeah.
we have Christ who has transformed what it means to be human. We have the saints who, think of Saint Mary of Egypt, who, talk about, like, compulsive behavior, was
Mhm.
able to become, as I've said before, I think the church's message that as we lift her up, is the ascetic saint par excellence, and giving her own Sunday, in the Lenten season, right before Holy Week.
Wow.
We look to her as an example,
Mhm.
and that is a hopeful message. Yeah, just because we mentioned it towards the end, I think what the last thought I'd like to offer is that, given that we're experiencing this influx of people coming to the Orthodox Church, and that first wave of people, of converts, maybe already experiencing what we talked about a minute ago with Orthodox burnout, and that sort of being overwhelmed, and losing some of that zeal, some maybe succumbing to some of that acedia. Um, you know, uh, I experienced that myself. When I became Orthodox, and just to trust the process, to remain with it. There's going to be seasons where God gives us comfort in the beginning of our journey in the church, or in our journey towards sobriety. There's grace there, and then there's going to be a time where it's work, and you have to roll up your sleeves, and to trust that the church, and we've mentioned the importance of the community, not just of Christ and the angels and the saints, but the people around us, and we need to seek people out. See when we're feeling like we're wearing thin, when our struggle with the passions, with our attachments, with our addictions, turn to somebody else, because everyone's in the same boat, and maybe they have something in their experience that they can offer you. But the enemy wants us isolated and feeling
Mhm.
alone. And so I just want to emphasize that last that bit about keeping at it. Like, the other bumper sticker you see is just today, right?
Yeah.
Just for today. Sometimes our spiritual life is going to be day to day. You know, keep me away from a drink or a drug just today.
Yeah.
So keep that in mind, and remember that the message is one of hope, and that you are not alone. You are never alone.
Yeah, that's so beautiful what Father Timothy said. You're not alone, right? But you do need to also find someone, right? Definitely in your parish, but when you're looking for a provider, you need to also find someone that sees and understands, right? From the Orthodox sense, and Orthodox is not just a label; it's actually has the truth, right? Truth is not just theology; it is something that it works for your life, right? And recovery by itself is also trying things that you haven't tried before, right? And so allowing, right? You've tried many times by yourself to beat this, but it's not, you need to make sure you're allowing yourself and God to help you, right? God comes in many forms, right? And so allowing him to help you. And for our ministry at I Am Recovery Inc., you can find us online as well. We have telehealth options where right now we're in California and Virginia. We're expanding to Washington State as well. We'll be expanding to other places, but we're Orthodox based. We have teams of providers from MDs. We have counselors, therapists. We have peer recovery support. We have even Orthodox chaplain, right? We so that puts in together all the different parts that we need to recover.
Look at that, you made it to the end. What an amazing conversation. Remember, all of our Patreons right now get early access and uncut, unedited access. There's this conversation in its entirety available right now, and it's actually been available for a few days now. So please go check out our Patreon. It is the best way to support Cloud of Witnesses. We really appreciate you. We hope that you enjoyed this talk. Give this video a like if you haven't already. If you haven't subscribed, please do so. Ring that bell. It helps others find this content. We look forward to seeing you in the next one. God bless, and bye-bye.